A judgment has now been reserved in this matter, this being NEHAWU versus the Department of Health. This matter is a matter that's set before Acting Judge A.J. Cook of the Labour Court here in Braamfontein from in the morning to this afternoon. This is where we see at the center of what is happening here, Diabo, being what you mentioned there, being the benefits of these workers, the safeguarding of them while they are in employment, and also just what would come through in terms of the salaries that would move from being a stipend to it being a tangible salary that will see them move and navigate this economy. We see them arguing here today that it's been a long time coming, Diabo. It's not the first time that you see them just basically sitting down with the employer to try and find each other here. It's a matter that's set at the Sectoral Bargaining Council, this being the Public Health Sector Bargaining Council, and they did not get joy there as the workers, and they decided that today they're taking this matter, bring it here to the Labour Court, whereby they want then for these workers, this healthcare, community healthcare workers, to be employed permanently. A lot of issues are coming through from them in terms of their day-to-day struggle, Diabo. As you can imagine, that the prices of food have been going up, and they've been navigating this economy with this stipend that they maintain that is not enough. But we see the SACP here, we see their mother body COSATU, which is also here in terms of giving support to the workers that are demonstrating here outside the Labour Courts. I'm going to bring into the conversation now the COSATU GS, this being Tate Solipetwe, who'll just give us a sense of the importance of seeing you, even as the mother body, leaving and coming through here to really be with the workers here in solidarity. And I know very well this is not the first time that you are engaging the employer to just bring and rope in these workers on a permanent basis. The court set, judgment has been reserved. Maybe give us a sense of how important was it that you apply pressure in this way?
Well, thank you very much once more. COSATU is here on behalf of the 1.5 million workers to support these workers, to support NEHAWU to take the fight to this end in terms of the legal battle that the workers have been facing. These workers of the community health workers are being exploited big time. As you know, that during the COVID, these workers were in contact with the communities. And this is the workers who are on the ground in close to the communities, close to the people of South Africa who are disadvantaged. Now, COSATU were here to support workers in terms of supporting NEHAWU, making sure that these workers are employed as permanent workers and that they have benefit. They are able to make some commitment. Currently where they are not able to make commitment. I was in court listening to the argument of the Department of Health. It does not carry water because Section 198 says workers who work, whether they are in contract or they are casual workers who work for more than 3 months, they must be employed as permanent workers. At NEDLEC, we are engaging to strengthen that thing so that employers must respect this section. At the National Minimum Wage Commission, the former Minister of Health, Joe Pasha, brought this matter to the National Minimum Wage Commission. All the 4 constituents rejected this matter that these workers must be employed as permanent workers. They must have a decent work. They must have a decent salary. Decent work, that means that you must be employed as permanent workers so that you are able to support your family. So on behalf of COSATU, we are here and we are saying the outcome of this court will be observed and see how far it goes. Then if it does not favor us, we'll have to take another route in working with the the NEHAWU leadership in supporting of these workers.
And we hear that these workers will also be pivotal in the rollout of the national health insurance in the country. Hence, they don't want to find themselves outside when we see the NHI coming through in the country. Maybe give us a sense of the importance of them being in the employ around that time.
Definitely, the importance of being employed as permanent workers. As you see that these workers are workers who have, as I said, they've been very close with the community in terms of the implementation of the national health insurance. Without them, there will not be an implementation. It's going to be running at a very slow pace. Tomorrow, we are at Parliament. We are going to picket and march against the austerity measures. In that case, we are saying we need an urgent implementation of national health insurance. And these are workers that should be there. As I said to you, the sexual determination does not give these workers a leeway of being committed. Sexual determination continue with the exploitation. It doesn't want these workers to be employed as permanent. And therefore, when they are not employed permanent workers, there is no way that you can be able to control them. They can be dismissed or they can be returned. They can be told tomorrow that the work is done, you're no longer having work. And that NHI will be stuck. So we need these workers to be employed as permanent workers and take a lead in making sure that the national health insurance is implemented.
I wanted to come there tomorrow in terms of the midterm budget policy statement to say, as the workers, what would be your expectations? We know that you'll be demonstrating there outside.
The expectation is that austerity measures must be rejected. We want this government, unfortunately, we are not supporting the GNU as COSATU, but we want this government to remove the scare things about austerity measures. We're expecting government to tell us how are they going to reduce the unemployment that we're facing in this country? How are they going to reduce the issue of the poverty in this country? How are they going to reduce the issues of inequalities? But thirdly is the issue that we want, the infrastructure that are stuck today because of the austerity measures. You know what is disappointed this GNU? They spoke about the austerity measures, but they increased the executive. What does that mean to you? It means the money that was supposed to be used to implement to service delivery to the people is now being given to the bloated executive. These are issues that as COSATU are going to raise, and this is our expectation. We need the people's budget. We don't need a austerity budget. That's what we want tomorrow. And we will be there in numbers. We've been working with the civil society. They will be there in making sure that the social relief that has been put in place, they must be increased. The 350 that has been given to workers who are not employed, it must be increased. If we don't do that, there will be no employment because they continue to give workers 350 rand. What is 350 rand? What can you do with 350 rand? It's nothing.
Thank you very much for your time, sir. Let's leave it here. He's coming through as the General Secretary of COSATU, and you hear him saying they're going to continue applying pressure in really fighting for the workers. They'll be outside Parliament as well tomorrow in a demonstrations where there will be that delivery of the midterm budget policy statement. But here we hear Judge Cook saying that he will deliver judgment through an email. He'll email it to these parties here. They're hopeful that the judgment will rule in their favor. But the Department of Health was not here to accept a memorandum of demand, which they're saying is the attitude of the employer towards what they're bargaining for here. Hopeful that at least they'll get a sense of relief from the Labour Court.